How is a mediastinoscopy biopsy performed for lung cancer? Imagine a tiny window into the chest that helps doctors see and sample the area behind your breastbone. That's what a mediastinoscopy is all about. It's a key procedure used to diagnose and stage lung cancer by checking the lymph nodes in the mediastinum, the space between your lungs. The process starts with you being put under general anesthesia, so you're completely asleep and pain-free. A breathing tube is inserted into your throat to help you breathe during the operation. The surgeon then makes a small horizontal cut just above the breastbone at the base of your neck. Through this small opening, they gently insert a thin, tube-like instrument called a mediastinoscope. This device has a light, a tiny camera, and sometimes surgical tools attached. As the surgeon advances the mediastinoscope into the mediastinum, they can see the lymph nodes and tissues on a screen. If any lymph nodes or areas look suspicious, the surgeon uses the tools passed through the scope to remove small tissue samples or entire lymph nodes. These samples are sent to a lab where pathologists examine them under a microscope to check for cancer cells. The whole procedure usually takes about 60 to 90 minutes. Once the samples are taken, the mediastinoscope is carefully withdrawn, and the small incision is closed with stitches. Afterward, you are moved to a recovery area where medical staff monitor you until you wake up fully and are stable. Sometimes, a chest X-ray is done afterward to make sure your lungs are working well and to check for complications like a collapsed lung. This procedure is especially helpful in lung cancer cases because it allows doctors to directly access the lymph nodes in the mediastinum. This helps determine if the cancer has spread, which is crucial for planning the best treatment. While it is less invasive than open chest surgery, mediastinoscopy does carry some risks, including bleeding, infection, hoarseness from nerve irritation, pneumonia, or a collapsed lung. Overall, it's a safe and effective way to gather important diagnostic information, guiding doctors toward the most appropriate care. If you are facing this procedure, it's important to discuss your individual risks and benefits with your healthcare team to ensure personalized and safe treatment.